What it is, what it do, cyber world. It is your girl, the one and only Ash Said It, ashsaidit.com, ashsaidit.com. Welcome to the Ash Said It Daily Podcast Show. I appreciate you guys so very much. Over 1,100 episodes and 500,000 streams worldwide. Thank you guys so much for your love and support. And today I am joined by Dr. Mardirossian. And how you doing today, Dr. Mardirossian?
Good. How you doing, Ash?
I'm doing pretty good. Awesome. Good. All right. So, Dr. Mardirossian, what brought you to the field of plastic surgery? What gained your interest?
Well, this actually, it's a loaded question. There's a lot of things that brought me here. Many internal and external factors. You know, the simple way of answering is, when I was doing my, I actually do 2 residencies. My first residency, as a surgeon, you have to go to residency. Mm-hmm. My first one was in head and neck surgery in Italy, and my second one was in head and neck surgery in the United States. So while I was in Italy, I didn't have much contact with plastic surgery because over there is just, it's a field that is occupied by the plastic surgeons only. Mm. Whereas in this country here, facial plastic surgeons are actually ENTs. Yes, the guy that takes your tonsil, he can do a facelift. So, 25% of the teaching in head and neck surgery is facial plastic surgery. So, you learn how to do facelifts and rhinoplasties and treat traumas and do complex reconstructions of the head and neck after cancer or malformation. But what especially got me into this field is, believe it or not, taking calls during the night in this busy city hospital, busy trauma center. I would get called at 2, 3 a.m. for, young patients, like essentially kids that would fight and you get cut and will arrive in the emergency room bleeding, and just like with a incision or with like a wound on the face. Yeah. And out of a sudden, you go there and you put it together and you do your best, and out of a sudden you look and they're like, they look great again. They look human again. So that's that's the realization that you can make a big change in a relatively small amount of time if you do the right thing. Yeah. And that's what got me in the first place. And this is what talking early on in my training, when you were running to the ER, doing things. And then the number 2 is, I think, the fact that I met a great teacher. Actually, I'm not sure if that's number 1 or number 2, but a great teacher is always a great incentive to follow a lead, to go into a field. And I was lucky that way. I was just purely lucky. And my teacher is one of the most influential plastic surgeons in the field of facial plastic surgery. And he, showed me the ways of facial plastic surgery and showed me that it could be fun. It doesn't need to be, going
serious.
Under the knife, this and that. It could be fun. And you should, in my opinion, to like doing something, you should have fun.
Yes.
Doing it.
I agree with that. 100%. You should love it. You should enjoy it.
Absolutely.
It should be something good. All right, you guys. So we're going to take a brief break. When we come back, we're talking more with Dr. Mardirossian, and we're going to talk about, entering that field, some of maybe the difficult aspects of it, maybe some things that he struggled with, but of course, his favorite part of the field. So you guys hang tight. We're going to be right back. Did you know that some foods can cause weight gain, body aches, and extreme fatigue? These are just some of the symptoms of food intolerance. Well, what is food intolerance? Food intolerance can occur when the body cannot properly digest certain foods. This can result in acid reflux, migraines, and so many other painful issues. How do you find out what foods are causing this irritation? It's easy. Pinner Test. With 500,000 satisfied clients worldwide, Pinner Test is the #1 way of identifying foods that may be causing discomfort. This simple at-home kit is easy to use, with results usually within 2 weeks via email. It's that simple, all right? What are you waiting for? Go visit pinnertest.com and use my special promo code AshSaidIt for your discount today. Welcome back to the Ash Said It Daily podcast show. I'm your girl, Ash Brown. We're talking to Dr. Mardirossian, and we're talking about plastic surgery. We're talking about his residency. So as you made that decision to be a plastic surgeon, you got your mentor under your belt, you're reading up, and you're studying up to be one of the best plastic surgeons in the whole wide universe. What was one of your first struggles? What were some of the things that you were having problems with?
Well, and this is not only for me. I think this is for all physicians who are devoted and want to do the right thing. Mm-hmm. Is really doing the right thing for the patient. Mm-hmm. I mean, example, I had a patient last year, right about this time, and she absolutely wanted a facelift and a neck lift, and she really needed it. Okay? Mm-hmm. So I saw her, we talked, I recommended it, et cetera, et cetera. And then I can't help noticing she got a raspy voice. Mm. And we joked about it. I said, oh, you can have a raspy voice, like that's all, it's kind of, how come, and this and that. We just talked about it. And she's like, yeah, I had probably a cold. Then she comes back for a pre-operative visit, because I always have a pre-op visit before the actual procedures, mm-hmm. because again, the risk benefits, so it should really be done that way. Not we take that very serious. Yeah. So, and she again has a raspy voice, and then she tells me that she has been smoking for the past 25, 30 years, that she doesn't have a primary care physician. So this moment I'm in a dilemma. This woman is coming, she wants a facelift. That's perfect, but she may potentially have an issue with her voice box. Remember, I'm a head and neck surgeon,
right?
Otolaryngologist or ENT. So my specialty includes also the throat, the ears, and the nose. And I've seen a lot of throat cancers. Mm-hmm. So, patient who is more or less a chain smoker, with a raspy voice, until proven otherwise, this could be a throat cancer.
Yeah.
So I said, well, at this point, and she's already signing consent and excited. I said, well, at this point, I would like to look at your throat, look inside your throat. And she was surprised. She was like, you're a facial plastic surgeon. I said, yes, mm-hmm. but this is one of my competencies. This is the right thing to do.
Yeah.
She's like, well, I don't think I'm comfortable with you looking in my throat because I'm afraid. She was anxious about it. And,
yeah.
laryngoscopy is a relatively quick exam, but you can take some time. And, it is somewhat invasive. But you do it with the patient awake. It's not a big deal.
Right.
And she goes, I don't really want to. I said, well, you either do it or we don't do the surgery. Mm. Because I said, if you have a cancer in your throat, being a smoker that you are, with no medical doctor to be your primary care physician, have you ever looked for medical advice for this problem? Okay? And if you really have a real problem in your throat, we may be wasting precious time doing a aesthetic procedure that does not need to be done, really. Mm-hmm. And so, and she accepted it, and we did the laryngoscopy, and lo and behold, she had no problem. Mm-hmm. There was no lesions, everything was clear, so we did the procedure as planned. But there is a moment, there's a bridge you have to cross, yeah. where you really have to be there and do the right thing for the patient. Mm-hmm. We are doing aesthetic surgery. It's a serious field. It has to be done the right way, but there are also priorities.
Yeah.
We should not forget that. And we should not forget it's surgery. So, it has its own complications. It has its own hardships. We got to go through. We're with the patient. We are there for the patient during the recovery as well, not only as surgeon.
Yes.
So, yeah, that this is not something I really struggled with, but it's a moment in which you put your conscience to a test.
Yeah, yeah. I agree with that, and I really love the fact that you you put aside, because unfortunately we do have some doctors out there that are just about the buck. They're just about, filling their pockets, but you are actually concerned about these people's well-being. And that is really the most important part about it, because like you said, if something was going on with that lady and you were unaware of it and you did this procedure, any number of things could have happened right there on the table or afterwards. And then they would be looking, at you
Even if
guys.
thing really happens, I mean, the patient, we don't really intubate for these procedures. The patient goes to sleep, and we do it, and we do a beautiful facelift. But you're wasting time.
Yeah.
Because, if she really had, say, she had a throat cancer, you're wasting time from treating the real
real issue. Yeah.
Real, a cancer problem. You're wasting that time doing a facelift. Now, everything has a priority.
Yeah. Last but certainly not least, what advice can you offer to any person now that aspires to be a plastic surgeon?
I'm sorry? Can you repeat again?
What advice would you offer to anyone that aspires to be a plastic surgeon, someone that wants to be in your field?
My postulates are three. They're actually in Latin. In Latin, it's essere, sapere, sapere fare. Essere means to be, okay? To be a good physician, to be a good surgeon, you have to be a good physician, obviously. But to be a good physician, you have to be a good person. Okay, there's no way around that, in my opinion.
Yeah.
Number two, sapere fare. Sapere means you have to know. You have to read. You have to constantly read. I read. Not like the years of when I was doing residency or medical school or anything, but I do read. I mean, I always read. My wife calls me the nerd. I always have a book, articles, how somebody does something. You want to learn new ways. You want to learn more efficient ways. You want to become a better surgeon, do more things. That's normal. And the third one is saper fare, means from Italian means know how to do. You have to know how to do the thing, and that's your skill set. So you have to develop all three of these at the same time, and that's really how you develop your personality in general.
Yeah.
But be yourself, be good, be people's person. If you are not a people's person, you can't do this job. You can't. You can do a great dollar job. You can be an IT specialist. You can be you could be an engineer. Fine. It's okay. It's perfectly fine. But to do this job, you have to be a people's person. You have to like people. You have to correlate with people.
I feel you on that one. Dr. Mardirossian, thank you so much for joining us today. We appreciate you so very much.
Thank you, Ash.
No, thank you. Let the audience know the best way to get in contact with your office, and of course, if they need to book you for some services.
Great. Thank you. Our office is in Jupiter, and our phone number is 561-624-0900. We specialize in facial plastic surgery. I would say in the most simple procedures, the most complicated procedures done today, and we'll be happy to help.
All right. Sounds like a plan. I appreciate you guys so very much. Keep in mind, anyone to tell you that you can't do what you want to do, you look them square in the face and tell them, don't believe me, just watch. Watch what I do. Watch me make it happen. Watch me make history. That's what we're doing this for. We're doing this for the history books. Social media is nice, but real life is way better. Until next time, you guys.